But first, a new LASIK procedure opening up the possibilities for people who may have previously been unable to have the procedure done.
Yes, Dr. Moshirfar from Hoops Vision is here with us this afternoon. All right, tell us about this new smile technology. I always love hearing about this because people who have never had a LASIK procedure done before, they really don't know what they're missing.
Well, that is correct. Well, you know, this is the good era to be an ophthalmologist because LASIK has been an enormous addition to the vision correction surgery. It's very safe and effective, but about 20 to 30% of patients cannot undergo LASIK because they're not a candidate for that. Smile can be an extra surgery in our toolbox to offer our patients that are interested in vision correction surgery, where we couldn't do that for them. It's just a very interesting surgery. It requires a special laser that creates a very small incision, about 2 millimeters, and that same laser removes a very small disc, a central disc about 6 millimeters from the central aspect of the cornea, and we simply remove that. So it's in a way a procedure for some of our individuals who couldn't get LASIK surgery, and it's just phenomenal.
Okay, so let's talk about the people who aren't candidates for LASIK and how this procedure, an acronym SMILE, would in fact help them.
Right. SMILE, or small incision lenticular extraction, would be good for some patients who have thin corneas, or they have some biomechanical instability in their cornea, or some patients whose job requires them not to undergo LASIK. And there are some job descriptions that prevent patients from getting LASIK. So this would be an armamentarium to be added to our surgery for those patients.
This is amazing, and I know the technology is improving all the time, which is why we love featuring these ideas, these concepts that can really help people. What about if you're just plain old scared to go under the knife? What if you're still just, I don't know, say a little nervous about someone getting a hold of your eyes to do a LASIK procedure?
Actually, this is a very good point. I'm amazed because most recent studies that are done, and some of them I published and others have published, show that contact lens use over course of time is actually not as safe as vision correction surgeries. So for those people out there who are wearing their contact lenses for 20 or 30 years, I always tell them the cumulative risk that you are taking with contact lens is by far much higher than any vision correction surgeries. Most recent FDA studies show that LASIK is one of the most safe, effective procedures for our patients. The thing is that your physician needs to screen you properly. They need to see if you're a candidate. And if you're not a candidate for LASIK, there is so many other procedures in our toolbox. SMILE, PRK, inlay, IOL. So these are all great stuff that we can offer them.
All right. Okay.
So don't buckle up your courage there,
all right.
Larry Pritchard. Dr. Moshirfar, we appreciate you being here. Hoops Vision, check them out. Hoopsvision.com is their website, I believe, correct? Hoopsvision.com. And we appreciate it as always. And maybe one of these days we'll get Lori in there.
That's right.
But it'll have to be you because I trust you. There's not very many other people I trust. But thanks for being here.